think we're all set.
Okay, great. So as Frank just said, I just want to remind everyone, welcome, and that this meeting is being live streamed and recorded. To begin, are there any additions or deletions to the agenda that anyone would like to make? Oh, that looks like nothing. So the next item would be to approve the minutes from last month's meeting. Can I have a motion to approve the minutes? Sheila, thank you. And a second. Larry, thank you. Are there any additions, deletions, comments, feedback, anything anybody would like to add to the minutes from last time? Okay, so it is so moved that they be adopted as proposed. Great. We will move to the privilege of the floor. Is there anyone who has anything they would like to bring up?
I believe we have anyone from the public.
Yeah, okay, great. And any announcements? No? Okay, we're good. The next item on the agenda would be the chair's report, and I believe everything that I would report on is something that's going to be covered by the agenda items, so I can talk about those when they come up. So let's move to Frank, the commissioner's report.
Hey, thanks, Maria, and good evening, everyone. Just wanted to really spend a couple minutes talking about the merger and some of the work that's going on around that. I think we talked at the last meeting about some of the things that are happening. Our admin is working to restructure, making quite a bit of inroads on that. We have some meetings scheduled in February with county leadership in finance and the county attorney's office to talk through the chart of accounts and what that might look like, as well as the process for charter updates. And we've also had cross-functional teams working on some of the strategic planning goals, one of which is actually making some pretty good progress, and that was the group that was working on identity, i.e. the name and logo for the future merged department. I sent an email this afternoon with some updates on that because I wanted to give you guys, some background on where we are and what we're doing, particularly about how the strategic plan kind of unfolded over the last year and a half, as well as the work of the cross-functional team towards finding a vendor to help support our work professionally as we move forward with the naming and logo efforts. And really where we are is the RFP has gone out, and we had about 20 respondents come into that. The team has reviewed those and narrowed it down to 4, and they're going to be doing interviews with those 4 over the next week or so to get more feedback and input about their processes. And so we thought this was a good time to engage with both boards, the Community Services Board and the Board of Health, to talk about how you might want to participate in this process. So as I think I've said before, the ultimate decision about the name of the department will be the legislatures through their amendments to the charter. That's where the county departments are established, as well as their name exists. So what we're doing is kind of, if we work backwards from that final decision, before that would ever come to them for a discussion, we would want both boards to have had a chance to participate in the process. And hopefully, we would want them to both to have had a chance to consider a vote of support to the work of the cross-functional team as it's established for this process. And then it would also need to go to HHS, the legislature committee that we report to. So what we're hoping is that by engaging you all early in this process, is that we'll have input and feedback throughout. You'll be familiar with the process as it unfolds. And so when we get to the final decision making, there shouldn't be any surprises. And it'll be something where, all along the way, you'll have been able to, provide whatever level of input that you would like to as a board. So I met with Samantha Hilson, who is our Director of Health Promotion, and Maria and Christina Moylan, who is the President of the Board of Health, kind of talk through, what might be some options and how we might engage the boards. And so at the tail end of that summary document that I sent you, there were a few options that kind of got pulled out. One was to engage the full board at periodic points, potentially by extending an existing meeting and or creating an additional meeting if that's what was chosen. Or potentially having a subcommittee, not our existing subcommittees, but a newly identified subcommittee formed to meet periodically with the vendor and the cross-functional team throughout the process and then report back to the board. And a third option was to have one or two members be identified to participate in the actual day-to-day in the weeds of working through this process with the vendor. And I can tell you that as a department and a staff, we're open to any and all level of participation that you as a board want to have. The one thing we're just trying to pay attention to is practicality. It would not be possible for the entire board or both boards to be in the day-to-day, kind of in the weeds with the cross-functional team and the vendor, because we just wouldn't be able to manage that and move, timely enough, forward through the project. So that's kind of where we are, and the options that we've laid out. There may be other options that you might want to suggest. And I just want to make very clear, our goal here is to engage all of you, both you and the Board of Health, in this process, because first we want to have a good process and a good end product, and then we also want to have something that at the end of this, hopefully we can all support, because what we don't want to do is spend a lot of time, energy, and money coming up with something and then having it not be suitable for the decision makers, i.e. you all and ultimately the legislature. So that's kind of where we are. And I wanted to lay that out for you and certainly field any questions that you might have. Maria, I don't know if you had anything you wanted to add to that.
I don't know.
So I'm happy to hear thoughts, suggestions on level of engagement. Are there folks that are particularly interested that might want to participate in a more intensive manner? All those things are on the
floor. So surprisingly, I'm not putting myself forward as participating in the weeds of this, but I think somebody or somebody's have to be, and I think it should start with the interviewing of the consultant. I don't remember what you called it, Frank. I just think that board members have a different position, which can be brought to the discussion of who the final person should be. And if nobody else jumps up and down to do that, I would be happy to be part of a review committee if the board supports that. I really think we have to figure out a way for the board to be involved in the kind of and we can define what we mean by into the weeds. I'm worried. Well, worried's not the right word. I'm concerned that there be somebody from our position in the discussion with the staff, so that there's a champion or an explainer of the process. And partly I'm not agreeing to do it because I have tons of other stuff I need to be doing. And I know that's true for almost everybody else. But I really think somebody has to be.
I agree, Larry. I think it's just kind of a matter of time.
Yeah,
It makes it tough.
yeah.
Are the meetings all virtual at this point?
Yeah, we would certainly make every opportunity virtual. I would share that, you know, each of the vendors that we're considering, they have some form of, call it discovery, for lack of a better way of describing it, where they need to get to know the organization. And so that's part of what the interviewing is going to be about, is fleshing that out a bit more with them. They do talk about focus groups in different ways. They don't all call them focus groups, but certainly want to get feedback from different folks. And I think, you know, another piece of the interview process is going to be explaining more thoroughly that I'm not the final decision maker. So while the contract may be with the department, when it's all said and done, we have this process, and we want them to understand that so that they can build in, you know, the feedback and necessary review from the, you know, the appropriate folks, you all, the Board of Health, and then ultimately the legislature.
I'd be willing to do it if somebody else did it too, so that if I couldn't make a meeting, I don't know if that's a reasonable way to do it, to have two people involved, but I'm just throwing that out there.
Dr. Duplan has his hand up.
Oh, I didn't
Not-
recognize about that.
Not to say you shouldn't have spoken out of turn. Not to say.
Dr. Duplan.
Hi, sorry I'm off camera. The idea of a merger, I mean, I just learned about it just today, and I wanted to understand more what is involved. Frank has been the commissioner for both public health and mental health. And then we had the mental health board and we had the public health board. And I think that worked well. So is the idea of a merger is just to have one unified board with both boards sitting together, meeting together? I mean, that's my question.
Sure, and it's a good question, Dr. Duplan. No, the merger that we're talking about is of the two departments functionally. So in December of 2019, the legislature, after a very thorough review, made the decision to authorize us to begin the process of merging the two departments together. At that time, I think it was pretty well established by both boards that they were going to exist as they do currently, and one, to help provide oversight of this process as we do merge together and make sure that, you know, both sides are equally represented as we move through the process. And then also, you know, working towards what it might look like in the future down the road if there was some different environment for the boards to work in. But that was kind of a secondary piece that would come sometime later in the future when the boards had seen what the merger looked like and we could talk about the legalities and some of the other issues associated with the boards. I think there has been interest from both boards of working closely together and figuring out ways. In fact, I think there's something on the agenda tonight to have a bit more conversation about that. But right now, there is no plan to merge the boards together, but rather keep them as they currently exist, pending some bylaw reviews that would occur, you know, with a charter.
Thank you. All right, I'm satisfied.
Yes, Sully.
Yes, hi. Yes, Frank, I would be interested in being a part of that process. I think also I'm still, learning and reading a lot about, the history and everything that has been done within the community, and also things that are happening in the city of Ithaca and Tompkins County. But also from, I do work in HR. I've been doing that for several years. So I'm familiar with the process of just screening and such. So I would be interested to see those steps and, give any input, as, a new person and such, if needed, if wanted.
That would be great. Thank you. So, I'm sorry, did I miss someone else wanting to say something? So, Sully and Jan could perhaps be a part of that process. And if one or the other wasn't able to make every meeting, we'd still have a backup person. Does that sound, Jan, that?
That sounds fine to me. I mean, if she won't, if Sully feels like she can take on the whole thing, that's okay too. I just knew I couldn't take on the whole. I didn't feel comfortable committing to the whole thing just because of time and other commitments.
Okay, great. So we have a couple of volunteers at various levels, and Sully will ask, perhaps if you're comfortable with this, is that you could take the lead for the board, participate with the Board of Health and the staff as part of this process, and you can pull Jan in as needed. Does that sound?
Yes, that sounds great.
Okay, and Jan, that sounds good too?
Yeah, that sounds fine.
Okay.
So as next steps, then Sully Sam will send you the invites for the vendor interviews, which are going to be happening relatively quickly. If you can't make them all, that's okay. Honestly, we were not imagining that you all would be a part of that, but if you're interested, we're happy to have you, and we'll give you the opportunity. And if you can join, great. If not, we'll try to fill you in on what we heard from those individual vendors. And then, of course, we'll help Sully keep the board updated on progress as we go forward.
Sounds good. Thank you, Frank.
Great, thank you.
Dr. Duplan, did you have something you wanted to ask or to contribute?
Yeah, I do want to volunteer also to be part of that process.
Oh, great.
Great. We'll send you the invites as well, Dr. Duplan, and if you can make it, great. If not, we'll try to keep you filled in.
Thank you.
Well, we appreciate the interest. It's an interesting thing, and I'm not sure where this winding road is going to ultimately lead us to, but I'm hopeful we'll have a good process that it will lead to something good, and something we can all support when we get to the end of the process. And I think that's all that I had as far as updates, Maria.
Okay, great. Thank you, Frank. Harmony, did you have a report?
Sure, I'll just give you an update on a few things. A couple of systems meetings that are going on in the community. The one is the System of Care for Children Services, and Mary has been the representative there. This week is the last meeting. They've had a series of 5 2-hour meetings. It's been a really wonderful, productive process, and at the end of it, there's going to be a really nice map of all of the children's services available in our community, and now they're working on really looking at goals and objectives of what we feel that we need to do as a community to really meet all the needs of families and children. I will let you know that OMH said we were the only county that has done this system of care process so far, that had every agency type that worked with children have a high-level leadership representation, and they're just really blown away in the meetings we have afterwards, blown away with the level of commitment, questions, just involvement of our community agencies, as well as children, youth, and a parent voice that's been at the table as well. So I'm sure there will be more to come after these meetings, because we'll have a plan that's developed on goals, and then some more work on how can we implement those goals. I wanted you to know that Suicide Prevention Coalition is in the process of formalizing their strategic plan. They have a number of goals. They thought they'd be a little bit further along, so they're refining those goals, and then they will be voting on them in their next meeting. Is what I'm expecting. They'll be voting on them in the next meeting. So hopefully soon we'll know what they decide. They really want to have the focus be there, and it'll probably be for the next 3 years, the plan that they're working on. And you also know we did the crisis intervention team training for law enforcement in the fall in 2021. And then after that, we also did a sequential intercept mapping process, which came as a part of that grant. And it really focused on the beginning stages of someone getting involved in the legal system. And we've recently received the report that was written from that mapping process. And so that group will be reconvening. The people who participated in the sequential intercept map will be reconvening, I think it's on Valentine's Day. And we're going to look over the plan, see what we agree with. Are there any questions? Give feedback back to the people who developed the document. And then they'll be starting to establish some next steps and how we can really fully implement the CIT model in our county, because the training of the initial group of law enforcement officers is the beginning step of implementing that model. And just to let you know, the clinic and pros, they're going to be working on a series of trainings in this upcoming year in 2022. We're really going to be focusing on trauma-informed care, suicide prevention as a champion for the zero suicide model, equity and diversity, and the treatment of co-occurring disorders. Those are going to be the 4 areas of clinical work that we really look at in the next year. Well, we're there in 2022. Right now, they do trainings every week, but they've been more on documentation and making sure we're just doing some of the nuts and bolts. But as the year progresses, we'll be looking at those 4 areas. Those will be our focuses. So are there any questions for me? Is there somewhere else on the agenda? I'm sorry, I don't have it in front of me. I'm at home because I've been training all day and I'm usually in my office and I have it up on my other computer. Is there something about our website on the agenda as well?
There isn't. So if you wanted to talk about that, that would be great.
Okay. I just want to give a big shout out to Samantha and her team. There had been some feedback around how difficult it was for people in the community to find out when our the substance use subcommittee, the mental health subcommittee, and the developmental disability subcommittee, when they meet and when the community services board meets, and getting access to those meeting minutes. And Samantha's team really did a lot of wonderful work and updating the mental health website. So if you want to take a look at that, you will see that the meeting minutes are now posted. There's a description of what the community services board does and what all the subcommittees do, and it's all organized there. If people are interested in joining the board, it's all in one spot. It tells them how they can reach out to talk with Corinne and get an application, or if they want more information, and it has that link right there. So all that stuff is now going to be available to the public. So take a look at it and let me know if there's any feedback, and then I can certainly check in with Samantha, but their team really pushed that forward once we got that feedback a couple of weeks ago that we really need to get that done. So.
Yes, Stu.
Where exactly is that website? How many?
If you just go in Tompkins County Mental Health Department, you'll find it.
Okay, it's under that, the old one, the existing one.
It's under the existing one, and it looks very similar, I think, to how the health department's website looks. So you really see it already kind of coming together, like 2 departments sort of blending together with a similar kind of look and feel on the website there.
So the improvement is it has the minutes as well as a little bit about the committees. That's great.
Yep. And it has all the dates of when all the meetings are, so people can click on and they can see where the dates are. They can get any minutes they want or agendas they want. And they can get a little description of what each of the subcommittees does.
How soon after the meeting will the minutes be shown on the website?
I don't know. Corinne,
It's like,
what, or Samantha? do
Generally
you
don't
know?
publish the minutes until after you all have approved them. So it wouldn't happen until after the next meeting, right,
Okay.
Sam? Isn't that, yeah.
good.
And Sam put the link to the webpage in the chat box. If anyone.
I love that there's links to the live stream and to the recorded sessions too. That's awesome. It's very, very clean. Well done.
Yeah, I like it too.
Yes, Larry.
Thank whoever did it.
So I'm absolutely thrilled. I hope one of the things that as we're developing the identity of the department, the web page, and any stuff that comes from the web page, like if we start to use the email system that Dominic Recchio, the public information officer for the county, has purchased that we can use. I hope that we'll ask the person who helps us with branding and with the image and all of that. We'll really look at the website and also our social media presence. I think we should have a social media presence, especially if we're interested in getting younger people interested in both the field, but also the fact that we have services. I mean, if our website looks interesting and is usable, which are, we hadn't for a long time. So I'm just thrilled, but I think the website is something to really ask the people who are in the weeds about our public image really look at, because it's one of the places where people will go. I often hear on Facebook about how good the health department website is and the public image around that. And it'd be nice to have something coming from our end of the department that looks as good as that.
Well, thank you very much. That is wonderful and makes everything much more accessible to everyone. So we really appreciate that. Thank you for all the hard work that went into that.
Maria, if I could, just before we move off reports, I'd be remiss if I went a meeting without talking about COVID.
Okay.
And so just wanted to let folks know that we're actually working with Lakeview on bringing booster vaccines to some of their sites. So we're working with them to try to make vaccine as available as we can. They reached out, and our vaccine team is working to make that happen. So good news on that front. And then also, I think since our last meeting, the Alcohol and Drug Council had their groundbreaking, or I guess it was more wall breaking on the facility up there on Trip Hammer Road. And so things are starting to get underway there, and they're hoping that within 12 months, the Open Access Center and stabilization services will be up and operational. So that was really good news to finally have that underway, because we can see a light at the end of the tunnel now for when those services will be available. So good news on that front as well.
Yes, Dr. Duplon, did you have something you wanted to add?
No, I wanted to share that for the first time in my 16+ years at Cayuga Medical, we have 5 psychiatrists on staff. 2 of them are very new. They newly graduated last summer. So I anticipate at some point after they get their feet wet that we will probably have excess capacity and be able to share with the community. Of course, I'm not the only person deciding that, but it's just an update that the hospital is, for the first time, fully staffed with psychiatrists. And I anticipate at some point would be willing to help with staffing in the community.
Sounds great. Thank you. Yes, Larry.
Before we move off the Alcohol and Drug Council, if you haven't seen it, there's a lovely video that they did that's attached to the press release they put out. And it would be great if we use that kind of those kind of videos to promote what we're doing. I mean, you know, what the mental health department and health department are doing. Videos are very, and if somebody knows how to do TikTok, we should do TikTok. But anyway, I love the video that they did. They actually showed people knocking down walls to get it ready to go. So it's really nice.
Neat. Dr. Duplan, I can't tell if you had something additional or if that's an old flag. Was there something additional you wanted to add as well?
No, nothing. No. Sorry.
Okay, great. I didn't want to ignore you the way I did it first. Sorry about that.
No.
Okay, great. Okay, so our next item on our agenda is a discussion of the bylaws. As people know, we have been talking for a bit about needing to update our bylaws, and this is probably going to be a process because, as people have brought up, with the change in the department structure, we will be looking at incorporating some understanding of Board of Health and Community Services Board, and we may want to talk about whether or not we want to incorporate anything into our bylaws that talks about coordination and cooperation. But the bylaws committee, who has been doing some really nice work, met last month and talked about what the current bylaws look like. And we brought up some things that we wanted to bring to the entire board for discussion, some items that are currently part of our current bylaws, some things that we want to just discuss with the whole board and find out what their feedback would be. We actually have a fairly long list, and so we're not going to get to all of it today, but we'll take some time and talk a little bit about a few of the items that are on our list. I don't, okay, I'm trying to think about how to sort of organize my thoughts. One of the questions that has come up is a question of term limits. And actually, if I could, Kaki, can I ask you to talk about the history behind term limits, what it says on the bylaws and what it says on the legislation and how they're different, and if we as a board want to or would like to make some changes or what we'd like our bylaws to look like with respect to term limits.
Okay.
Thank
Well, I'll just remind everybody, a few months ago, we had a fairly lengthy discussion about that issue in one of our meetings, and the end result of which was everybody wanted to continue to think about it and that we would come back and kind of revisit the thing. And to remind you, the New York State statute and the mental hygiene law limits CSB members and subcommittee members to 2 terms of 4 years, which Frank, I sent you an email about, so I just wanted to make sure that got connected.
I did. I forwarded it on to the county attorney, but as you can imagine, in his new role, he's got a lot going on. I have not heard back from him yet.
Who is the new county attorney?
William Troy, Bill Troy.
Okay. So the legislation calls for term limits of 2 limits unless the local government changes that. The Tompkins County Charter removed any term limits. So there's, as I recall, I don't think there's even anything in our bylaws saying there's not term limits, or there's also not anything saying that there is term limits. So the question is, as we consider what do we want in terms of our sort of process kinds of parts of our bylaws as opposed to the more philosophical, or, you know, how we're operating as in that coordination and cooperation that Maria was talking about. Do we want to consider term limits? Last time there was some talk about 2, there was some talk about 3 terms, there was some talk about, I don't think we should have term limits. So we just wanted to throw it back out for discussion in terms of what might have percolated in your brains in those, I don't know, it's 4 or 5 months ago when we had that conversation. And I know it's a little uncomfortable because we've got a number of people right now who have been on this committee for 20, 30 years. So that's probably not the most comfortable thing to talk about, whether we should have term limits. Certainly any decisions we make going forward could grandfather anyone that was currently, you know, in terms of their terms, you know, and anybody filling out their terms. I mean, so we can deal with the question of what do we do with people that are right now on the committee separately from, as we think about going forward, do we want to consider some kind of term limits for the board and or the subcommittees? Does that frame it for us? Okay.
Yes, Elise.
So I think in a lot of circumstances, I think that term limits are important, but I think that there are certain exceptions to the rule. And I think this advisory body is sort of in that category because historical knowledge and institutional knowledge is so important. And I think that from what I've observed over, I don't know, I guess maybe it's been 3 years that I've been on the board or so, I've observed enough of a mix of new people and people who've been on for a really long time that that just occurred naturally, that it hasn't seemed to be too much of an issue. I think that churn will always occur, whether or not we put term limits in. But I feel like that longevity of participation is just so important. I mean, honestly, if you think about what, you know, folks like Larry are able to contribute to the conversation just because of the, you know, sorry, Larry, but decades that they've been involved and all the history they have here, I just think it's really valuable. And I don't know that we would want to stop future generations of members from being able to create that historical knowledge.
Yes, Kaki.
I guess I would just ask whether there's a chilling effect of having a large number of members on for a long period of time, and what is that perception outside of the committee? And does that stop people who might be interested in participating from feeling either that they would be welcome to, or that there's any point in throwing their hat in? And I have no answer to that. I'm merely throwing out the question, particularly as we look to diversify and such. You know, I'm glad we've got some new younger members. Thank you, Sully. You know, but also, you know, what does allowing that kind of longevity do in terms of what the evolution of the committee is? Again, I'm just throwing the question out.
Yes, Sully.
Sorry, I was trying to find the button to unmute myself. But I agree as well with Elise as far as I think it's really important to have people who have been, you know, with the board for so many years because of the committee and the involvement in the community. I think that it's, you know, it's just important. I would add that that perhaps, and I don't know if we already do this, but perhaps providing like strong periodic evaluation systems so that, you know, there is a way, like if there is a need or, you know, we are finding that perhaps something is not working out after someone being, sitting on the committee for a long period of time, or if perhaps, I don't know who, if Frank gets reports, if someone feels uncomfortable, or if there are any disagreements and such that happen after a period of time, if that's something that he gets, and then an evaluation would happen. As someone that is new to this committee and a couple others, I find it extremely beneficial to just be able to sit with someone that, knows a ton. No matter how much you read, you still can't gain all the history. But I do understand at the same time that, it is a little bit intimidating as well, joining something new and realizing that, mostly everyone that has been on the committee has been there for a long time. So you kind of feel like, will you ever be as, knowledgeable as them? But I think that goes away with time.
Thank you. Yes, Sheila.
Yeah, I guess I'd like to look at it from a perspective of if, given the board that we have now, we don't have term limits. Are there things, or have there been things that we have not been able to do because we didn't have term limits? I guess what is the impact right now on the board, positive, negative, with having, without having term limits in place? So I guess, is there a problem? And, if there isn't really a problem with the way things are now, then I guess my question would be, why would we want to change it? We have a lot of expertise on the board. We have a lot of long-term members, sure, but we also have new members. So I'm just, just throwing it out there. Do people feel that there's something missing, something that we don't have because we don't have term limits?
Yes, Jackie.
Well, I guess I don't know that there's an answer to that question, Sheila. I mean, at least we can only answer it from our perspective. And that's what I'm just asking us to kind of think about. Could there be other perspectives than ours? And, again, I don't have an agenda. I'm not trying to argue one side or the other. I just, are we insular? Are we not recognizing perhaps what the value could be? Which may be outweighed by the value we have of long-term members. The
only thing that I would add, just to sort of recognize myself for a minute, is that it's in the statute for a reason. So I think it's important to consider that we have chosen to do something different from what the statute has established. The second thing is that I think there's a case to be made for a balance between institutional memory and history and fresh perspectives and the changing of the community and the way that things may be different, that newer board members could contribute. So I think a balance is really what we're looking to find. And the question is, do we have the right balance now? And is it do we want to stick with being different from the statute, or do we want to be more in accord with the statute? That's really my thought. Yes, Larry.
Actually, technically, we are not in contradiction to the statute, because the statute allows the county to make its own decision about term limits, and the county legislature has decided, for whatever reason, and they probably don't even historically remember why. So we are in compliance with the state law and the county charter. I want to say that I think we're doing a pretty good job of bringing people on onto the board and allowing them to learn about, and I don't mean that in any sort of like, you know, beneficent way. I just mean people, I think it's pretty easy for people to make connections if they want to and figure out what's going on. So I think I would be one of the first people to say something if I felt like people weren't sort of participating or there was something wrong. I mean, that might have been self-serving, but I think I do have a history of saying that. For instance, Maria, you've been on the board for about, what is it now, 5 years or a little less?
Yeah, something like that.
And you, in that 5 years, went from being a member to being the chair of the board. So there wasn't something that kept you from, you know, making choices and decisions and taking on the roles that you wanted to. I mean, Sully just agreed to take on a huge project that usually would have been left to, you know, a quote unquote more experienced board member.
Yes.
So I feel like we're bringing on the new blood, and people who feel like they need to leave are leaving when they feel like they need to leave.
The only other thing I would add that your comment kind of reminded me of is that when I look at the composition of the board, many of us are of a certain age. And there could be, if we do not think about term limits and bringing on people of a variety of ages, you know, it's conceivable that in a 6-month, year, 2-year time, we could lose a lot of people to retirement and, you know, those sorts of changes. So it's just another reason to think about why we might want to be bringing in more people. Yes, Elise?
So one of the things that we have done on the New York State Rehabilitation Council this year, which is an advisory body similar to this in that it's required by law, and there are term limits on the State Rehab Council. But one of the things that we have decided to do was to refocus our membership committee. And the membership committee has a renewed scope of work, which includes, you know, to Sully's point, evaluating members on an annual basis. And it's not extensive, but it's basically like looking at attendance and engagement and thinking about whether or not a person should be. So every time a person's term expires, they are either invited for their next term or not invited for their next term. So there's that gate there. There's a little bit of a process. So that people can't just self-select to stay on. They, you know, they have to be welcomed to stay on. The other thing that we've tried to do is we've decided, because we have very, very specific under the law, we have very, very specific representation that we have to have. And when we don't get that representation, we've decided to target it. So we still have an open application process. Anybody can apply, but then we will make lists of people to invite to apply so that we can try to fill some of those gaps. So we may think about doing something where it's sort of like a half measure between hard term limits and, you know, membership committee has to determine that you need to be re-invited for your next term, and then doing some targeted recruitment when we have openings.
Dr. Duplon?
Oh, hi. I have been on the committee. I have been on the board for 16 years. I think I got admitted to the board the first year I moved to Ithaca, and it's been 16 years. I'm happy to talk to my junior colleague about taking a turn to the board. Just to make it fair, and I think young people have new ideas I mean, you all have realized I'm not much of a talker. I'm a listener. So I did sign up for another year on the board, but I will actively recruit one of my junior colleagues to maybe take a turn to the board. My question is, can someone return to the board after having someone else cover for them?
It's,
I-
it's
What exactly do you mean, Dr. Duplan? You mean if you were to step off and someone else was appointed in your place, could you in a few years decide you wanted to apply again? Sure, nothing would stop that.
Yes, that's my question.
And in fact, we could have term limits that allowed someone to, you know, re-engage after some period of time or something like that too. I mean, any of that's. I got to say, I'm incredibly uncomfortable with the idea of any kind of sort of peer evaluation of board members that's making a decision as to whether or not somebody is invited to reapply. So
It's very attendance based, I will say. It's not super subjective. It's pretty attendance based.
then what's the point?
Because when we have members that don't attend subcommittees and skip meetings, we want them off so that someone else can have their seat.
Right. So we have a provision that if you've missed 3 in a year, that the board can recommend that you be removed.
yeah.
Right, that's been around for a while.
I mean, so purely on the attendance piece, we've already got that covered.
Right. I think the bylaws say that the board at any time should have 2 physicians or a physician and a psychologist or 2 psychologists on the board. So
Yeah, a physician and a psychologist.
yes, Dr. Morg is there. I have been the physician for the last 16 years. And my question is, if I can recruit one of my junior colleagues to join the board and for whatever reason, they don't want to be on the board, I mean, can I reapply to be on the board?
Yes.
There also can be more than, there's no limit to the number of physicians or psychologists. That's just a minimum.
Just to be clear, the answer to Dr. Duplan's question as it stands today is yes, you could be reappointed.
Yeah.
Thank you. Okay. I think I can entice one of
Stu, did you
my
wanna-
2 junior colleagues to join.
Yeah, my experience on the board when we've talked about tenure or term limits, it's been discussed, and I think majority of board members do not want term limits. I think I had mentioned or stated last board meeting or time before that, being on the nominating committee, it's last couple of years, maybe it's COVID, maybe it's, we've been discussing amongst ourselves in the nominating committee, you know, why aren't we getting, why are we having openings on all of the committees and the board as well? We've never had so many openings. And all the time that I've been on the board, which I just figured out, I've been on this board half my life.
You shouldn't laugh, but that's wild.
Right? Yeah. That's
Yeah.
like how many years? And then how old? Okay. Yes. So I like it. I liked it. I want to continue. I do want to be able to suggest, as we've done with the chair has a term limit, 2 years. And then we have the vice chair ready to take that position down the road. And that's kind of a nice process because it gets that new chair ready to take on that responsibility. And looking around the room, there's a lot of chairs here. And I think we've had the policy, we try not to pick the same chair twice and give most people an opportunity to be the chair. But the subcommittees, I think it would be great to have a vice chair. You guys call it dual chairs. I'd like to call it a vice chair. In the subcommittee, I think Tom taking over was comfortable for him, because whenever I was out of town or I couldn't make it, I'd contact him and he would take over and run the meeting. And finally he says, you know, I can do this. And he started to become the chair. And long story short, I think it was a little bit too much for him. And we do have this new system now of going into the different committees and encourage people to become chairs. But if we had some kind of, 4, 6 year, 8 year limit on the chair, and then we had somebody standing by as the vice chair to step in, that's a thought. That's, that's kind of a term limit, but that would be my only suggestion for having some kind of term limit. Right now we're down, I think, in every category, in every committee, including the board. I remember when I first joined the board, I think I was one of the younger members, but I got a kick out of how much information they all knew and how much time it took for me to get the names and the letters together of, what are they all talking about, how this works. So I think any new member would say it takes a good year or so just to get used to figuring out what's going on. So term limits, we have them, I think, in place for the chair. Term limits for the subcommittee chairs. I think that person should be there for a while, because it is a lot of knowledge and a lot of networking, and you should know a lot of the folks in the community, and that takes time to build those relationships. So I don't see a 2-year leadership role as a chair as being something that's going to be good for the committee. But if anybody has any thoughts about having a term limit on a chair for the subcommittees, I think 6 or 8 years might be a good time to get somebody to take that role and see if it can either go in the same direction or in a different direction. So, and I could talk more about, I think we're on the bottom of the list for the nominating committee. Talk a little bit more about that, but not much.
Yes, great.
there.
Well, we will come back to you when we get to our nominating
Right.
committee item. I have a couple other people who have their hands raised, so I just wanted to recognize Kaki and then Jan. So Kaki, did you have something you wanted to?
Okay, I'll be fast. I guess I'm being kind of the contrarian tonight. From what Stu has just said, I want to challenge us to think about and maybe have some conversation at a later meeting about why we are not retaining members and why we're having trouble attracting members. There's COVID, there's a bunch of things, but if that seems to be the situation where we're at, I think we need to have some serious thinking about it.
That sounds good. And Jan, did you?
I was going to say something similar to what Kaki just said, but I was going to preface it by saying the feedback I've gotten being on the nominating committee is not so much that they feel intimidated by, all the all the people who have been here forever and know so much. The feedback is that I've heard the most is that they just don't feel like they don't understand the purpose. And I think that's something we need to really talk about is what is the purpose? It feels like we've kind of lost our way a little bit. To me, it just feels that way a little. And I hear some of the people who come to the committee or come to the board and then leave kind of express the same thing. Like they got on it because they have this interest and they want to help, but they just feel like it's, you know, a bunch of talking heads, basically. I mean, they don't say that in those terms, but just to make it short, I'm saying it that way. So I just think that's something for further discussion about how we can become a more purposeful group, really.
I would like to kind of agree with what has been presented by the last three contributors that in fact, we also had a discussion at the bylaws meeting about purpose, which is one of our there's a paragraph about our board purpose. And one of the things that came up during our discussion was that we do not seem to, the board as it currently functions does not align with the purposes identified necessarily in the bylaws. And so this is, I think, a really good discussion for us to have at some point about how we bring those two closer together and what we see our purpose, defining our purpose, and moving more closely to the that vision, that mission that we would identify. As far as term limits, it sounds to me like, just to sort of summarize, there is value in institutional memory, and there is value in new energy and new people joining with new perspectives. And so people have endorsed a perhaps half measure. It sounds like if we could come up with a half measure that made sense, something like, and this is just, I'm throwing this out here because it's kind of popped into my head as an idea as when we were talking, but maybe after 2 terms, we recruit for a position. We may not fill that position, but we do a more active job in the way that Elise was talking about looking at whether or not we need to recruit. We may or may not be successful. And then we would have, so it wouldn't be a firm term limit, but we'd be more active at the end of people's terms to really assess with them and with the board and with everyone what the step would be for that position. Probably not an assessment necessarily, because we already have something that addresses attendance. So more of a functional kind of look at where people are, what they're thinking, what they want, what the needs of the board might be. How does that sound like that summarizes our discussion? Nobody's nodding, so I don't know if I did.
I
Yes,
think
sir.
you did.
So just to add some history, we have in the past developed taken a look at who's on the board, who's on the subcommittees, and developed sort of a grid of things that expertise that we wanted on the board, or expertise that we wanted to have make sure come to meetings. So we could do that again. It's one of the ways that we got Kevin McKenna, is because we identified that we wanted a police officer, or we wanted somebody from law enforcement or from first responders, because of how much they're involved in the way our system works. So we have done that. And for instance, if we wanted a teacher on any of the committees, or we wanted somebody, you know, with X expertise, I think we've done that before, and we could do it again. And I guess I agree. I do agree that it would be a good idea to look at our mission again and to see if we find it interesting enough in the way that we put it. One of the things, I'm on the county's Human Rights Commission, and this is I think my third year. And one of the things we do at the beginning of every meeting is read the mission, you know, so that it's always in the front of people's minds. You know, and so we could do something ritualistic like that. You know, just to keep it in the forefront of our mind.
Yeah.
But I agree. If there are a lot of people who feel like we're not exactly hitting the mark in terms of what the Community Services Board is doing, this might actually be a good time to do it with the merger and the discussion with the Board of Health. I should say that, you know, at this point in my life, I would probably come to the Community Services Board meetings, whether I was a member of the board or not. But, you know, I don't think there's a huge amount of support for term limits, but if there comes a point of having term limits, I don't have a problem with it if we decide that that's the direction we want to go in.
Okay.
I just like to make a decision because we've talked about it a bunch.
Yes.
I think term limits are premature in the sense that that's a small part of what I feel like needs to be a larger discussion about our purpose. How do we carry out our purpose? How do we explain our purpose to others? How do we orient new people to the boards and subcommittees? Because I think that's not a strong point for us either. I mean, I think we have something in place, but I think we could do better at all of those things. So it feels like the term limit thing is a small piece of that. So that's just my opinion.
Okay, sounds good. Well, I think a lot of people agree with you because I saw heads nodding as you were speaking. So it sounds like this is something we will continue to revisit. I want to leave time for the other items on our agenda. So if it's okay with people, if it feels like we've had a bit of the discussion we needed to have here, I'd like to move to the talking about fentanyl-laced drugs in our community. And we have had a couple of board members approached, and I'm wondering if either of those people would like to talk a little more about this topic.
Sure. I mean, I can start and Jan can feel free to chime in. So interestingly, last month when you asked about what type of, priorities we should have for 2022 and, fentanyl-laced drugs in the community is something that I've been thinking about quite a bit and thinking might fit within the scope of this board. And then coincidentally, a couple of weeks ago, someone reached out to Jan and I, a friend of ours who lost her son in Ithaca at age 23 to fentanyl poisoning last summer. And she is a person who has a very, very long history in Tompkins County as a human service provider and is in fact an executive director of an agency in Elmira. And so, we began a dialogue about potential action steps that we might be able to take to address the crisis. And I think through speaking with her, one of the things that came to light is that there's a lot of underreporting, or there may potentially be some underreporting of fentanyl poisoning. That it's a serious public health threat all over the country, including Tompkins County. Anecdotally, she's spoken to other families in Dryden and around the area who've also lost family members to fentanyl poisoning last year. There are known drug dealers in the community who are selling fentanyl-laced drugs, and there's not been, as far as I understand, a lot of action taken regarding prosecuting or arresting those folks. I think that just in terms of determining what we're here for, you know, if there's anything that we could do that's important, I also think at cross purposes with the Board of Health as well, or not at cross purposes, in sync with the Board of Health priorities, is address an issue like this one. And I think that, you know, we have a responsibility to the community at large, but in particular, a community with such a large student population, to do a better job of making the community aware that the fentanyl-laced, drugs of all sorts are circulating in our community, and they are killing people. And I suspect that a lot of the people who are killed by these drugs probably don't have people to advocate for them, probably don't have a mother who's an executive director of a human service agency who's going to make a lot of noise. So I think what I'm sort of hoping that we might consider is forming a joint task force that's time limited and really defined in scope, that might be able to take a look at this problem and gather some data, maybe seek out representatives from substance use organizations, the colleges, the Ithaca City School District, and really try to understand the problem a little bit better, to formulate some recommendations. And I think in the short term, one of the things that's occurred to me is there's never been a time, probably in history, when there have been more eyes on the public health website on a daily basis. And so I feel like if we have a known danger in our community, that we may be able to use some of the communications channels of the health department to make people aware. So to be specific about it, I'm not 100% positive, but I believe that my friend's son who died was looking for Percocet. So he was not a fentanyl user. He was not an opioid user, or I guess that might be an opioid, I don't know. But he was not looking for fentanyl. That's not the drug he was trying to use or take. And it was instead given a lethal dose of fentanyl. And so if you think about the rash of deaths in Brooklyn last year related to fentanyl-laced cocaine, for example, fentanyl-laced club drugs like ecstasy, Molly, it's terrifying. And from my perspective, it's terrifying as a parent of two teenagers who may unintentionally, you never know, take something that they didn't intend to take and die. And that certainly happened, around the country. So I think that's sort of like a framing up of the issue. The individual who contacted us, we have permission to talk about her. It's AJ Kircher, who many of you probably know. And AJ may be willing to come speak to us at a future meeting about her experience related to the death of her son.
Yeah, I think that about covers anything I would say about it. I guess I thought about a couple smaller things too, like why doesn't this come up more often? And why isn't there more talk about, kind of maybe a subgroup, or once in a while, a group meeting of substance use and mental health subcommittees to discuss that really clear interaction between people who are either taking drugs to quell mental health issues, or they or the opposite. It's hard to say, but it just seems like there, when she brought it to our attention, it did seem like wow, we're really not even talking about these things. Now, I'm not on the substance use subcommittee, so I shouldn't say that they're not talking about it. And the only other thing I wanted to say was I believe his drug of choice was cocaine. I'm pretty sure.
His drug of choice was cocaine, but I believe that in one of the tragedies about this particular story is that he was not using cocaine at the time.
I thought she said he was, but yeah.
It could be, yeah. I mean, there's details there that I'm not entirely sure of.
Yeah, and I think, as is often the case, stories, how they say to publicize things, tell a story, have someone share their experience, and her possibly sharing her experience really brings out a lot of flaws in how we treat these kinds of issues. And I'm not saying anybody's to blame or whatever, but I think we have kind of dropped the ball in terms of paying attention to this. And that's all I think I have to say, other than what Elise, I agree with what Elise said.
Cool. Sully?
You're muted.
Sorry about that. Thank you. So I just wanted to add, because this topic is actually a really big topic that we have here in the community and in other organizations that I'm a part of. As I mentioned previously, prior to me joining, my brother had actually passed away last year from an overdose from fentanyl. Same story. That was not his intention. But, on our end, that's kind of, that's part of the game. Like, we know that, if you're out there and you're using or you're trying something, there is a risk. And it's, sad to say, we just know that that's just how it happens. What I wanted to talk most about, and what I think is most important, that, it's very challenging, is a lot of the times that people are using, or most of the time why people are using, it is very connected to, obviously their mental health and, just mainly it's depression, because of the lack of, the resources that they have, not finding housing or not finding a good job. I think that it's, the outreach or, putting the awareness out there is important, but I think that digging deeper and finding solutions to find specifically Black males, opportunity for better employment, helping them with, literacy. A lot of people I help, they're having a hard time even applying for an application online, so being a Black man and having, being looked at as the provider and not being really able to find a job other than Dunkin' Donuts or doing custodial work somewhere else, that you after a period of time. So I think that, I know that's not what we do as a community as far as mental health, but I'm just saying that there are definitely, there are bigger roots to the issue, and that until those things are being taken care of in the underserved communities, it's going to continue to happen, because, drug use is just, it's a release. It's, we know, like, that's just your therapy. And a lot of people in the Black and brown communities don't feel comfortable, going to therapy, or even, and even if they do, because I've had several friends tell me they went, but even when they went, they still lied about how they're feeling or what they're going through, because they feel judged, because the person that they're speaking to or the people that they see don't look like them. So it's uncomfortable. And like I said, I don't want to keep going on, but it's definitely something that it is a struggle, especially in the Black and brown community.
Thank you, Larry. And Larry, after you, Stu, and if we could just kind of keep it kind of quick, because we also do have one nominating committee piece of business that we need to complete, and I do want to
quickly. I typed in that Binghamton is having a upsurge of this too, and part of the problem is that people are taking, that fentanyl is becoming more and more common. I mean, it's in all these drugs. And so users are being encouraged to have test strips and to have Narcan with them and to know how to use it because it's so common. So it's not just that a few people are coming across bad drugs. It's that it's so much a part. And I actually wanted to ask Frank what you know about overdoses and deaths related to fentanyl in this community, because I can't believe that if it's happening in Binghamton, there have to be some deaths that are happening here that get reported to the health department, or, you know, what do we know? Because I think this is along with COVID, this is a public health emergency. You must think that too. And I think we have to do something.
Our overdose deaths, unlike many other places, have not really risen, statistically from year to year over the last 2 years. That doesn't mean we don't have a problem. We absolutely do. And we did have another death that was fentanyl related. I guess now it was about 3.5 weeks ago. The medical examiner does run a tox screen on all deaths. So that way we are getting a better idea of what is involved in those. But I think you guys have hit all the points. Fentanyl is in every street drug that you get a hold of now. I think that's pretty much accepted. And the challenge is the damage that's doing to folks. I think, we're talking about fentanyl and not being in the forefront, but pre-COVID, fentanyl was something that was, on the news pretty frequently. It was something that I think law enforcement and others were raising the alarm bells about. I certainly would agree over the last couple of years, we've definitely not been talking about it and really need to shift some communications around that. And we can definitely work on that. So it is most certainly an issue in our community. There's no doubt, just like it is everywhere else. Our numbers are low with overdose. They're not zero, so they're higher than we want them to be. But we haven't seen spikes associated with it just yet that we could point to. But I think we can certainly, do messaging just as other communities are.
Stu?
The fentanyl-related death, I think, reached a peak around 2017 and 2018. The substance, at the time called Substance Abuse Subcommittee, now called Substance Use, we keep changing names, took that serious. And Frank, you probably can verify the numbers as well. Every day somebody was overdosing from drugs. And for a period of time, they didn't know exactly why. The fentanyl that was coming into Ithaca and coming into America was very cheap. Example, if you buy a dime bag of heroin, let's say that cost you $50. Well, fentanyl comparatively is $10. So if you mix heroin with fentanyl, the dealer is making money by buying a cheaper product. The person who's using it most like the 10 times the high feeling that the fentanyl is giving them compared to the heroin that they were taking. But a lot of people didn't know it was in there. And you take something that's 10 times more potent and your heart stops and people would die. Well, in the committee, we heard these stories and acted by allowing Narcan into every person who is available to work with substance use people, mental health workers, nurses. I mean, it just became abundant. We were all taught how to utilize it. You go back to that old movie where they stick that in the guy's heart and like, ouch, it's not as harsh as that, but most people know that they can take heroin and now cocaine and now marijuana. There's fentanyl in marijuana. There's fentanyl in cocaine because it's cheap. And the novice who's using it does not have a tolerance for that kind of drug and will be more affected by it. There be more chances of them ODing and dying because of that. A person who uses it because they're addicted to it, they're dying too, but they have a better system now. They don't take it alone. They have a buddy with them who has a Narcan, and if they go out, they get the shot. I mean, again, this has been going on for the last 5 years or so, and I think it has been taking a backseat since COVID. And Frank bears out some of the numbers. It has decreased, but it's still very much out there. It's economics, it's drug abuse, and you have a mental health problem, you're going to try something to, self-medicate. And then voila, there's a lot of people who get addicted to it. It's no longer a mental health problem, still is, but now it's an addiction problem. And give me anything. Okay, there's fentanyl in there, so what? I'll try to take a little bit less. But that's why there's so much overdose across America. It's not like what was talked about. It's not Binghamton. It's not Ithaca. We got hit big time around 2017 when one particular Chinese, I can get into more details, chemist got the market. You can get it online. You got it, and then you put it in all the drugs to make the drugs last a lot longer and make the drug dealers that much more richer. So it's still going on. There's still a lot of unanswers for it, but it has been something that certainly the agencies, if the council were here, if CARS were here, they would give you a litany of things that they have done. REACH in particular has done a lot to try and resolve this fentanyl problem. I can go on, but we're in a time limit, so I'm going to stop there.
Thank you. Yes, that's important information, and it sounds like we've started an important discussion. So I think this is an important topic for us to continue to address and to think about what steps we would like to take to begin to have some kind of positive impact in our community. Nominating committee. Did we have, and I know we haven't left ourselves much time, but did we have a nomination to present? I believe we did.
No, we don't.
We don't. You're right.
Right. We have somebody submitted a resume. Right.
Yes.
We're in process with somebody. We have the resume. We met, and one of the criteria for presenting the nomination through the nominating committee to the board is they attend a meeting. And this person was going to attend, I believe tonight, but is out of town. So we're waiting for that person to perhaps attend next month. And after that attendance, the nominating committee, I think preview looks favorably on this applicant.
One correction.
And we are down in each one of the committees, and we do not have any, I'm aware of, any applications for, I think substance use is down 2, maybe 3. If somebody else says that they're leaving, that hasn't happened. The board is down at least 1. Mental health is down 2, and DD is down 1.
Great.
I just wanted to correct one thing. This person that we're looking at is not a candidate for the board. So it wasn't tonight that the person is out of town. They're a candidate for the substance use subcommittee. And so they'll be out of town for the upcoming meeting and will attend in March. So Probably we won't be talking about the person until probably April meeting of the CSB.
Right, it is the substance use application.
And then just very quickly, we did have nominating committee members attend the meetings for the mental health subcommittee, the DD subcommittee, yes?
I'm doing that tomorrow.
No, DD is tomorrow, right? And then the substance use subcommittee. Once all of those meetings have taken place, we'll send out a follow-up letter requesting information on anyone who's interested in being elected to subcommittee chair, and then we'll move forward with the chair appointments, the elections for the subcommittees. So that's where we stand on that.
Right.
Look
Meeting
at
is
that.
tomorrow, Sheila, at 10.
7:02. Does anyone have anything else they would like to say quickly before we? Yes, Larry.
I thought I heard Jan and Louise say that they had a recommendation for some urgent action, and as a starting place, I'd like to suggest that we have the substance abuse providers come and talk to us about the state of fentanyl problems in the community at our next meeting, so that we have a sense of what's going on, what they're doing, if what they're doing is adequate, and what kind of help they could use from the board and from the mental health subcommittee, and if they think some kind of focused, time-limited strategizing would make sense, because they're on the streets, they know what's happening. So I wouldn't want to do something, that they wouldn't support. But I feel like the reality is, for whatever reason, street drugs are now, people who use them should assume that they are, that they contain fentanyl, and that they, and if we just put out that message, that might be enough. But I would like to suggest that we invite REACH and the Alcoholism Council and CARS to our next meeting to give us an update as a place to start.
Sounds good. Well, we will work on reaching out to them. Yes, Paula?
Would we also want someone from law enforcement to be involved with that?
Yeah. I mean, whoever it makes sense, yeah.
And one other thing, my cat's out of surgery and doing fine.
Oh, poor kitty.
Okay.
And what about having the parents speak, or even if it's not the parents, a person who's experienced it in their family, like Selma, because they're the people that are going to say, this is what was so troubling about it, or this is what was so hard.
Yeah.
And it may not be, excuse me. Never mind. That's all I wanted to say, really. It may not.
I think, Jan, I think a big part of what AJ was trying to convey when she reached out to us was her interaction with the system. And I think, that's where we can kind of pick up that thread.
Yeah.
Great. Okay, well, it's 7:05. Do I have a motion to adjourn the meeting?
I move we adjourn the meeting.
Thank you. And a second? Travis?
I second.
Thank you so much.
Hey, everybody.
Bye.
Good night, everyone.